We are going to look at Africa's resilience during COVID-19. But before I proceed, let me introduce our guests who are here live with us. We have Dr. Janine Uwimana Nicole, public health specialist in health policy and systems, senior researcher and lecturer at Shelter University in Cape Town, South Africa. And she's a visiting lecturer at the University of Rwanda. She's a specialist in maternal and child health, public health nutrition, and infectious diseases. Dr. Janine is also the founder of Hands of Hope for Africa. Welcome, Dr. Janine.
Welcome.
Thank you. Thank you. Thank you for having me.
Yes. And we have Mr. Evert Mugarura, Executive Director, Africa Youth Leadership Development and Health Initiative. And he is a public health specialist for over 15 years. And welcome, Mr. Evert.
Thank you. I'm happy to be here. Thank you.
And we have Grace Quinje. Grace Quinje is a journalist and international relations diplomat expert. Welcome, Grace Quinje.
Thank you.
All right. So COVID-19 has happened and it has affected all of us. And each country responded differently. In this time of COVID, we have seen Africa being resilient, and that's the reason why we have to talk about it today. So there has been cooperation and partnership between communities, security forces, and health systems in containing the virus. This is a high level of resilience. I've never seen those different organs coming together, immediately to work together to contain a virus, a new virus that we're not used to, but they really reacted so immediately and the response was good. So the question here, how can this resilience be boosted? Because it shows that it's something within us as Africans that we have, but we need to boost it. How can this be done? Any of you can respond to this. Just the floor is all yours if you have anything to comment about it.
Well,
Hello, can you hear me?
Yes, the resilient, this is Evert Mugarura. The resilience we are talking about towards COVID, as you said, is different across countries. I'll talk from my own experience here in Uganda, but of course I'm not ignorant of what is happening in other countries. But here in Uganda, we can say we thank God because since the epidemic started in March, when we registered the first COVID case, unfortunately, we've lost 5 people so far. Out of the over 1,000 cases that we have registered. And that's a clear indication that at least I can say, yes, it is a pandemic, it is a problem, but has been friendly, if I use the word, friendly to us, not to kill us seriously, knowing that our health system is the weakest globally, but we have survived and our people continue to live their lives amidst this pandemic.
Excellent. So it shows maybe it has something to do with the strength that was actually within people, but maybe this was the time to discover that strength that they have and the skill they had to deal with problems. I think as Africans, and I think it's very important to recognize that that resilience within us.
I think the response was good. It was a timely response. But of course, there are so many factors surrounding this resilience. Some are scientific, others are, the way we are structured, also inform the way we survive or not. But for now, the response was so good, multi-sectoral, including both the health practitioners or experts and other players, including the military, which was on the forefront, fighting the virus, having been prepared and trained for the same. Our weak facilities this time did well. Our people came in and they were managed with the COVID, and they were able to come out, walk out, and they're back into their homes. So that resilience is good. But I would say that I'm proud to be an African, because in Africa, we have had several cases of infectious diseases like this one. So it is not new to us. And therefore, the response is not a surprise, but an experience that we have attained over time, trying to respond and mitigate for such and similar epidemics and pandemics that have come our way, including Ebola, HIV and AIDS, which we have lived with for years, and other infectious diseases. So that's where we draw our experience to have this kind of resilience and response that we are seeing today.
So our resilience is drawn from lived experience.
Yes.
Yes. Yeah. Have you got something to add on, Grace, on that?
Yeah, I like it. I like that Dr. Yvette has mentioned the examples of Liberia and the Uganda. Uganda is one of the success stories that was able to deal with HIV/AIDS at a time that there was so much stigmatization, but they were able to contain it. And then with Liberia, Ebola, we know only 5,000 people died because they were able at that time. This was a post-war economy. Things were really bad in their country and things could have gotten out of hand, but they were able in such a vulnerable state to contain the pandemic. So it's these are examples from Africa that shows us that at times when when COVID-19 started, the fear and the feeling was very stereotypical, that this is Africa, it will suffer the most, or Asia, for instance, also will suffer the most because of the strata in our global politics. But this has not happened, and I'm happy for this platform because we are trying to unpack why this has not happened. And my question, when the articles started coming out from the mainstream media that, like Belgium, for instance, is affected and all these countries, Italy, then Africa is going to be brought down on her knees. It takes us back to old stereotypes, narratives, which are even, I think I can put in the word racism, to do with our capability and capacity as a people to deal with our health issues. So I'm really happy for this discussion, and I'm happy that we are also discussing, our success stories, Uganda and Liberia, and I'm happy that even former president for Liberia, Sirleaf Johnson, came out very clearly and she was reminding the world that, look, we went through this and we managed to minimize it. I think Ebola, only about 11,000 people have died. It did not become a world pandemic. So as we are assessing, and I'm happy we have two experts here. I'm just a journalist, I'm not an expert. So we can learn and understand what the different dynamics and how Africa is able to do this.
Excellent, excellent. Dr. Janine, have you got something to add on?
Yes, thank you. I think I will just a little bit, but concurring with what my predecessor have said, both the Reverend Mugarura and Mrs. Quench. I don't know if I'm pronouncing properly.
It's okay.
Yeah, so
Grace.
yes, so we are still yet to come up with the right answers that scientifically proven to inform the resilience of the African continent. But what my predecessor have said already, some of the factors that we can confidently say that has helped us as the African continent in responding to COVID-19 pandemic, it's prior experience for the country that were exposed to Ebola, and those in other countries based on other infections that one HIV is one of it, biggest, and then we've got as well some other infection that you know still that we faced, and you know in form of outbreak, cholera and so forth, that our health system were prepared to deal with over time. So that is one of the factor that makes that the health system to be resilient in one way compared to what had happened in Europe, where they had to experience more death. There are other factors, couple of factors that are explain the death outside of the health system. But for us, what was awaiting, everybody was awaiting to see the worst with the cognizance, knowing that our health system are not that very strong compared to the other countries in the West. But we have proven to be a little a different narrative, which is a blessing in disguise, if one would say, for the African continent. So somehow we portray some resilience based on how we've been, you know, the health system has absorbed the shock from other previous infections that, I mean, epidemics such as HIV, like Mrs. Grace has rightly said, Uganda is a success story for HIV. For Liberia, Ebola is one which is a cousin sister of COVID-19. So they have managed to successfully control the epidemic. It's based on the preparedness the country had based on Ebola. And it's very important for us not to forget that we do have some level of preparedness in some African countries because of them being prepared, of being exposed to COVID. Nigeria is one of them as well. Although there's a number of high cases of COVID, but the death is not that high compared to what you see we experience in Italy and other European countries, or in the US as well as a big power. And the same apply as well to small countries such as Rwanda, where they were exposed to Ebola, but the success story of Rwanda now, it's based on the preparedness they had from Ebola. That's what made Rwanda to really to be one of the top countries on the continent that has been able to contain the disease this far. That's if you talk around the public health system, but there are other factors that one could look that explains the resilience of many African countries or the African continent as a whole. So we got a bit of time to prepare ourselves. And as well a certain kind of unit, the unity that came within among African states. The first time I've seen in my years of experience where the African Union had taken leadership into this COVID-19 and, you know, trying to emphasize and in terms of our countries to work together to fight the pandemic. So that is also another factor that explain that the first has not come to us, and we don't hope that will even come to us yet.
Yeah. That's very, very interesting to hear. And I really loved the creativity that manifested during COVID. How us Africans started making like face masks from scratch. We never used it before, but people find a way to make it. Even creating the water, like running water, some areas in the villages, we don't have running water.
Sanitizers,
yeah. So I love that creativity. And this is not because COVID came, it is something that we had within us. And that's why I'm emphasizing we have the ability, we have that creativity, we have that, we have the skills to make things. But then COVID really enabled us. I take it as an opportunity because I could see many talents that I never thought they existed before. Even from myself, I could do things that I never thought I could do. So how can this go on beyond COVID? Because we have seen that our people can actually create, they can actually make things. They can be so resilient in so many ways. They can fabricate things that would really help them come out of the problem and overcome the challenge, obviously. So how can we make this one go on beyond COVID, create others? I mean, I don't know what Africa needs. What do we need? Because we do not have to just remember, in this time, we created face masks, we created this and then forget. No, we don't have to just remember, but we have to keep on creating.
Thank you, Ematha, for that observation. Indeed,
yeah.
We demonstrated to the world that the common saying that necessity is the mother of invention is true, even as we face coronavirus.
Yeah.
Here I have a mask which was made. I think this is homemade, made by my wife. And this is part of her clothes, but she designed it very well, and it serves the purpose. You don't have to import a mask. A mask. And that, then to your question, I mean, here it is. I can put it on, and it works very, very well because it is a mask. See, homemade mask, made in Uganda. Now, to your question, how do we sustain this creativity? That's a big and $1 million question. Because one of the things that I have not liked personally, as an African and an advocate for self-reliance in Africa, is the way we have been brought up to think that we cannot sustain ourselves or even sustain what we have around us and make use of it for whatever use they are meant. To sustain this will require attaching value to what we have already created. The sanitizers are being used everywhere. I'm a Secretary General to the Public Health Specialists in Uganda. And at the initial stage when a sanitizer was a new vocabulary in our society, you know, everybody was talking about sanitizer and we didn't understand what sanitizers meant. A group of public health specialists came together and they went through the process and produced a sanitizer, which I witnessed, and we marketed it, and it worked. And at that time I said, wow, look at this. These are mere public health specialists, but they can also produce a sanitizer. But all of us were waiting for PPEs from China, you know, I mean public personal protective equipment from China, from Germany, from Belgium, from US and elsewhere. Thank God we did not receive because it was a struggle to get these commodities from outside, for this equipment. Everybody was competing for the same commodity. And as such, we were left like orphans without PPEs. And eventually people started thinking, using their minds, which they already had. And they started making these personal protection equipments here in Uganda and in Africa, across Africa. So how to sustain, to me, would mean that we interfere with the spoon feeding that is always ready to come to us and say, I can help you. Why do you want to help me? Why don't you allow me to help myself? And that's the epidemic that we have not fought. You want to help me. Why am I disabled? We even know that being disability does not mean inability. Why do you want to help me? Why don't you allow me to create and sustain what I have created and depend on it to move me to another level? So that's my response. I don't think we are able to sustain this, but my appeal to Africans is that let us embrace what we have around us as opposed to what we see outside countries and think that they are better than what we have. What we have is already a value, and it is sustainable, it is easy to access, and therefore we need to emphasize it more than ever before and stop relying on foreign support, which does not help us to sustain the development around it, and therefore we remain beggars because we cannot sustain ourselves. I think a mask like this one would be a demonstration for that. I'm talking of a mask, but I'm also talking of the economy. I'm talking of other things, but let us stop it at the gadgets that we created. How do we sustain? By discouraging the foreign interference.
That makes a lot of sense. Yeah, go on, Grace.
I agree and I disagree.
That's fine. That's absolutely fine.
Yeah, I agree in the sense that, yes, we have to cut off foreign assistance and aid. And I like the last discussion you had on your forum where you were discussing aid dependency. But I think there's a moral issue here. And I know that as Africans, we want to distance ourselves from being manipulated through aid, and we want to start our own processes. And I like what Yvette has just said, that we attach value to the processes that we've been going through in the past 3 months, difficult months. But there's a moral consciousness also on the part of the global community, in the sense that we are suffering. Our health institutions are incapacitated to deal with health issues because of their conditionalities, because of what the International Monetary Fund, the Bretton Woods institutions foisted upon us. So they have benefited at the expense of us as Africans. And I believe there's a moral consciousness when it comes to situations like this, that they should be able to assist us. So yes, there's a moral value and to us doing things on our own, but I feel just like people are saying Belgium must pay compensation for what happened in the Congo, in Rwanda, that's my position, that they should not be let go just like that. They should be made to pay. So on the one hand, we are strong, we are working, we are working and we are going to do this, we are working out the mechanisms. On the other hand, I feel that there's a moral obligation, especially when it comes to a pandemic like this one, where they have to, fork it out, because our health institutions are not in that state necessarily because of our governance, but because they have invested in the wrong areas, and people have to suffer. Grandmothers are the ones who are having to, we talked about HIV/AIDS, who are having to look after. Look at South Africa. Right now, I was looking at the statistics in South Africa, and a lot of the grandmothers are the ones who are looking after, because of the lockdown, a lot of these grandchildren have gone back home. You know, it's a broken society, and I had not understood the level of brokenness in South Africa. But Gogo's grandmothers are the ones who are still holding that fabric, who are still, they are still sustaining that part of the economy, society. When their children are dying of HIV/AIDS, they take over to become mothers, again, looking after grandchildren. So my point is that why should that grandmother suffer again when Europe has so much money, when Washington has so much money to make it possible for hospitals to be equipped and to be not as aid, I'm contradicting myself, but my point is that that money is ours and it must come back.
I do agree with you. I do.
We're not begging for it, but you know, we were cheated out of it. I might not be making sense, but that's what I think. Like, you know, we can walk on our own, yes, but they have to pay something because they cheated us.
Yeah, before we move on to that one, but you know, there's something, it's not an interesting story, but personally I liked it. When COVID hit, everybody stayed where they were. They remained in their home countries. Nobody traveled. That means rich and poor had to stay to rely on the same health system.
Yes.
You know?
Yes.
Not like other days, good days when I could travel to wherever I want to go for medical, you know, attention. But here you are obliged to stay in your home country. So now my question really goes to the leaders of African countries again. What did they learn from this in terms of really relying on our own health system? This is a time we realize that, okay, this is our health system and it is the only thing that we have now. Is it working well? Does it need improvement? So I don't know if there is any lesson learned from that. And I think there should be, because we had a moment to reflect on ourselves and also observe carefully what we have and what should be improved. I don't know if that makes sense.
Yeah, so if I may come in,
yeah.
I wish you could ask the ministers of health and other officials to respond to that question.
That's right.
In particular. So, well, we are technicians, yes. But I mean, the COVID-19, there was no way out. People were going to travel out. So they had to rely on what is at home. Like I said before, COVID, it's an opportunity for the African continent in so many facets. And I think that it's going to depend on the leadership of each country going forward here. So we've seen different style of leadership in handling the pandemic, and that's what will dictate what will happen after COVID-19. So the message is very clear and loud to say that this is an opportunity for African countries to build their health, to strengthen their health system. But again, coming up again to what other international politics within health, so-called the global health, there are some other politics that will require a strong leadership from our leaders and including our health professionals or public health specialists, the people, the technocrats, if I would use the term, to see that it's a moral responsibility, obligation to make it to leverage on this opportunity that COVID is giving us. So it has to start from within to appreciate that opportunity and use that opportunity. And that it comes strongly from a strong leadership. Besides this, if we don't have a strong leadership, it's gonna be again the same old story. We are still battling with HIV, and where this in most of the health system have been weakened by the so-called international AIDS or national approach, where it's not the healthcare system that is strengthened, rather a disease, because money is channeled one particular disease instead of looking at the health system in general. So in my capacity as that has been the message that we are preaching, to say it's not about a disease, it's about the health system. Somebody even recently, one of the officials here in South Africa that I've been interacting with, where we were looking at non-communicable diseases. Now, no one is paying attention to non-communicable diseases. They have dropped, yet we know that non-communicable diseases are rising on the African continent because obviously of a different mode of lifestyle and other elements that contribute to it. We have as well chronic diseases, HIV, tuberculosis, where the service had to be interrupted because everything has been around COVID. Now, it has a negative effect on the health system. Looking at addressing the burden of disease at a country level. So you have to look outside now to say, if we're having all this funding coming in to rally for, to fight this pandemic, this funding should not be to now forget about maternal and child health, forget about HIV, forget about tuberculosis or hypertension and diabetes that is rising. This money support in to strengthen the health system so that the health system will be able to respond to all the diseases. What now countries in Africa have got as an opportunity, the money that comes in, the money that has been mobilized within locally, because countries actually came up with their own solidarity fund to respond to COVID-19. But that money, then one has to use it in a proper way that will strengthen the health system so that it becomes stronger going forward. So that another COVID-19 becomes it becomes then as a springboard to address the loop that I've known all along within the health system, within our socioeconomic condition. It's not COVID that just began, it has just opened up the calm of one that we have known all along. Things that we need to deal with, or what we would call social determinant of health. So we need to deal with addressing the social determinant of health. And COVID has given us an opportunity. So here, leaders and even health professionals like myself and everybody else is to see how do we address the social determinant of health in this time of COVID, so that post-COVID we'll be able actually to maximize the health gains through what the fund that and different other opportunities. So for me, I'm emphasizing mainly on the leadership because the global politics will still going to continue. Health is not just a matter of having this, it's a politics on its own. That's why one has to apply the mind of trying to use the right kind of policies in countries that will strengthen this health system and protect the people from other outcoming outbreaks or other social ills. Thank you.
Yeah, I don't know if someone has something to add on, otherwise we'll go to the questions. Some people sent questions to us.
Okay.
Yeah, so someone is saying they're...
I would just quickly add that I agree with Dr. Jeanine. What is missing in the equation are not the resources that we require. Actually, what is missing is the proper programming that we need. We need appropriate programming. We need to prioritize the needs of our populations, and make sure that whatever money is coming is directed to the real needs of our population. That is a missing gap. What I see, Grace, don't attack me.
No, it wasn't an attack, but you are keeping them.
I strongly believe in working in partnerships with the development partners out there, if they can add value to what I intend to do. But what has been in the equation and the missing gap is that we have left the development partners to rule over the whole direction of our resources and the resources they bring in. And at the end of the day, we miss the mark. It is like hit and run kind of programming, which is a bad one, is very, very unsustainable, and therefore it cannot meet the needs of the population that we are intended to serve.
I totally agree with you. I said that in jest, but I agree. And of course, the control and manipulation that comes with it is just horrible. I agree.
And that is
just
kind
to
of
add on that.
Yeah, sure, go on.
There are some good examples. I mean, all this, it's all stem around the good, the leadership here. Obviously, what the Reverend has mentioned is key. That we should this international donor or international aid should not dictate the agenda of a country. They are development partners. That means we work together. If you are coming to assist me in my home, allow me to tell you how I want you to assist me. And that will depend on, again, on the leadership within a country. There are countries where they don't even use international aid money because they are sufficient, and it has somehow corrupt our brain and the auto-dependency, where we think if we don't extend our hand, we can't do anything, yet we've got enough resources. So there is a kind of incentive somehow that has created a particular kind of a behavior, attitude, and system as African, where we think the West should give. Yes, there is that moral responsibility. And as well, the global responsibility, a pandemic such as COVID, it's rightly fit for, for international organizations to come and help the ones that don't have. But we should be cognizant of the genesis of why these countries are now even not performing in the first instance, because these African countries, they've got resources. So if it's not working, then you rather first saying, let me fix the house before somebody else. If money at all comes in because of the moral obligation or responsibility, should be much more to enhance, but not what would dictate our annual budget for ministries and so forth. That is unacceptable. It's not sustainable, because when the money is come, for example, the Reverend Mugarura here has worked with in many years in the fight against HIV. When you get the money from PEPFAR, CDC, all of them have got an agenda, and they've got a particular way they would want the money to be spent. Does not most of the time favor the current situation that you're living in our own country. So it should take a Minister of Health to say, like, for example, in Rwanda, it's one of the example. I'm not boasting because I'm from Rwanda, but let's learn from some of these good examples so that we can actually help ourselves as a continent. We have there's a committee or a structure where all development partners come on board to help the country according to what the country has said they would want. So that dictates how this international aid will be dispersed, or they will be dispatched in different countries' priority. So if we can use that approach, then that means you are still in control. But then what is different in other African countries is would come, they'll say we want to put mosquito net, or they would want to finance money just for supporting counselors, adherence counselors for patients who have HIV, and you wonder, this person who has HIV has got tuberculosis. This person has got as well hypertension or diabetes. Why will I not use that money and support the one patient? But they will dictate you to say you cannot use this money for other programs. So that's defeat the purpose.
So that's the urgency, like the urgency. You can't determine what is urgent, what is critical.
They always decide what you have to use the money for.
That should be determined by the country itself. So the donor is coming. I'm also not saying that we should not get the money from this international aid. We should, because they've got a moral obligation. That is a set. But countries should be the one to dictate how to be used, not international organization donors
as a conditionality
to come and tell us how to use the money. And again, why do in some instances it's not even important to have these monies? Teach our people to look within, to use their own resources.
That's very key. We need to know how to use our resources. We need to rely on our resources first and to create those homegrown solutions. So we have this question here. It says, Africans are at high risk of COVID-19 in Europe, America, and the United Kingdom, but they are safer in Africa. How relevant is this? Because here in Europe, UK, and America, obviously, Africans are dying the most, and yet it is the opposite situation in Africa. Could you tell us why and what is the magic behind?
Well, if I may come in, I mean, why people, African, if I would say COVID it's affecting mainly, if I would say American or Africans, in developed world, it's because there are many various reasons here. Most of the African people in Europe or in America, for instance, in America, Black Americans are still living in poverty, in a low socioeconomic state, and they are at higher risk of having non-communicable diseases. So if you are a candidate of diabetes, you are at much higher risk of contracting COVID-19. So that explains why we do have as well a high number of people with COVID-19 among Black American. We still have poverty. We still have lacks of proper health care in America.
And we still have poverty in Africa as well.
Pardon?
We still have poverty in Africa as well, and people are not dying.
We still have poverty, yes, in Africa, but the problem here it's not a bullet. One has to look in context. Black American, if I'm particularly for Black American, if you have to bring as well, for example, in Europe, most of our Africans are immigrants.
Yeah.
They still experience lack of proper services, screening services. Most of them are the ones that have got a high burden of non-communicable diseases. The moment that you've got a weakened immune system because of existing of a particular condition such as diabetes, hypertension, or any HIV, or any other disease, you are prone. I told even for those smoking, having asthma, and we know majority of our people do smoke, and most of them are prone to be respiratory conditions. So when you have already a predisposing factor, when COVID comes in, you don't have so much higher chance. You will die. That's how COVID-19 is showing. Unlike here in Africa. In Africa, it's although we do have limited access to health care, the burden of non-communicable disease or diabetes and hypertension is not that much higher in the economic, in the lower economic structure, the so-called people who are, they don't have diabetes that much and hypertension.
Hypertension, obesity.
Hypertension among those who are in the well-off. That's where you get the diabetes and hypertension because of sedentary life and other lifestyle and diet, the type of diet that protect their immune system. And they are not that much more prone to lifestyle diseases. So,
thank you for answering that, Dr. Janine. Thank you. Everyone got something to
I
add
also
on?
understand that there's the issue of immune modulation, because for instance, in Africa, I don't suffer allergies, but here in Europe, I suffer allergies. Like in Africa, I can run, I can go into the grass in the woods, and I've never ever suffered allergies. But here, like right now, I'm actually struggling with allergies. So that's one of the reasons. I'm not a health expert, but it's one when when COVID-19 broke out, I felt really vulnerable because I was showing some symptoms of what they were saying people who have COVID have. And I then got to understand why I suffer these symptoms here in Europe, and yet in Africa, I don't suffer them.
Could we say that maybe weather has also some role to play in that?
Yes, to do with the tropical climate, and then you have to go back to the savanna climate. Yeah, the weather also.
Okay.
I don't know.
The weather is not yet something that is proven yet. No, I tend to evidence yet.
Yes, that one is still under study. But if it is proven scientific that the warm temperatures do not allow survival of this virus, we shall thank God.
No, that's not what I'm saying. I'm giving my own example of, like, in Africa, I don't have allergies, like I don't suffer allergies. I'm not concluding this heat thing that Africa we are not, no, not that one. I'm just giving my own, because I was given that the reason is to do with immune modulation. I'm giving my own example. But that one to do with why in Africa we are not dying, I don't buy it, because we shouldn't be dying. Why should we die?
No,
I'm giving my own example that in Africa, I normally don't suffer allergies, but here I suffer allergies. So something is amiss there.
Yes.
Yeah, and we are not even done with COVID. COVID is still there, but it's good to know that where we have strength and build on it and make sure that we become more stronger. Go on, Mr. Everett.
Janine and Grace, I agree with you, both of you, especially on the issue of the immunity of the community will definitely determine how much dent this COVID can make in that particular community. But the other issue we need to put into consideration is the population, the population itself. Demographically, Africa is majorly made up of the young generation. That's very, very important in terms of the transmission of this virus. When you look at Africa, just 3% of the region's population has a population that is 65 years and above. So, and the rest, like 44%, is a population under 15 years. Looking at Uganda alone, 78% is a generation of young people. So when you are looking at this COVID, the virus transmission, you also put in the
young
age
population.
factor plays a big role. of course, in combination with what Janine talked about, non-communicable diseases is definitely a big factor. When you have a chronic disease in your system, then you're highly prone to the COVID attack, and the survival chances are very limited. So,
thank you very much for highlighting that.
Of course, all that is done in combination with other many factors, including access to the healthcare that we have talked about. If you get a cough, a serious cough, do you access healthcare immediately? What kind of healthcare? If you are not on insurance, does it favor you? So looking at the African Americans or Blacks outside Africa dying of COVID more than the rest, we have to factor in that accessibility, affordability, and the immune system, then the age factor and others, so that we can conclusively say that probably, given the conditions, that's why we have that problem higher or bigger, stronger in that population, in our brothers and sisters outside the continent.
Yeah, there's another question saying that according to the World Health Organization, about 220 vaccine trials are underway. Any ideas how many of these trials are going to be used in sub-Saharan Africa? I don't know if anyone has an idea of that.
Well, all vaccines are supposed to be used anywhere.
Okay.
But the challenge we have with the vaccines today, again, like Dr. Janine mentioned, the global health politics is actually tampering with the whole process, whereby it has created a lot of mistrust. Something that should be a straightforward thing. We know vaccine works. A pandemic, a virus like this one can only be managed or even terminated, eradicated by use of vaccine. That's the surest deal we can think of. But now there is mistrust. There is politics. Who takes on which vaccine do we use? And for me to answer this question, I don't know even who is doing these vaccines, for what purpose, if I use the word, for what purpose? Is it intended to help us get out of this COVID pandemic very fast, or it is business as usual?
Yeah, that's the problem again.
My questions. So I don't know if they will be used here, tested here in Africa. Do we have Africans on these teams? Because we are supposed to have Africans on these vaccine development teams, so that we are
South Africa. Yes, South Africa is one of the African countries that is running the vaccine trial.
And Nigeria.
So yeah, Africa now on board, and it's something that was clearly stated and to WHO and the international community. Hence, we have the trial that is running here in South Africa to inform, that is run by by African themselves and so forth, and CDC Africa and other institutions are informed. So the issue, I think there's also a clear message out there that is not African alone, but as well some other activists, health activists are saying that when the vaccine is available, it shouldn't be the old game. We shouldn't play the same old game. It should be now accessible to everybody at the same cost. So we are still awaiting to see how things will translate into practice.
Yes, yes. But we want to, maybe we want to say that we welcome the vaccine development because we know it works. Let us not be misquoted that we are against the vaccine. No,
Yes.
Vaccine
I
work.
think the issue for Africans was about being used after Bill Gates made a
Yes.
statement. I think the issue and the fear was that once again, we're going to be used as guinea pigs. So that was the, so it wasn't so much about not wanting a vaccine, but us being used as a laboratory that might end in failure and we being the casualties.
Yes. Thank you.
Yeah. Thank you. And the other question says, African women are the key pillars of resilience, and the future will be more devastating unless governments and development communities consider gender equality in tackling COVID-19. What do you have to say about this?
Women?
Yes, because they are the great pillars of resilience. They are the great pillars of our community. But probably the fundings are not so much looking into how to help them, support them. They're looking into other areas, COVID-19, but not considering a woman in a community. Yet she's a pillar of the resilience. Without her, maybe you have no community.
Yes, again, that one is, it goes back to leadership and governance. But I would just say that agree with you that these are the women, our mothers, our wives, our daughters are the pillars in our society. They shoulder a lot in terms of protecting and even causing development and growth of our societies. They are shock absorbers for our society. But they are not targeted most times for programs that will help them to be good shock absorbers. And but I'm very happy in Uganda today, even amidst COVID-19, at least there was a deliberate effort to ensure that especially like pregnant women would have access to health care, lockdown. So the ambulances were put there so that whoever needed support got it. And of course, that to us, that was a great strategy and service, because we did not lose a lot of women wanting to deliver and they cannot access health facilities because of COVID, because that's to lockdown. Or babies wanting to be treated and they cannot access health facilities. So I think that was a good move, but a lot more is needed. A lot more is needed to ensure that the women are at the center of healthcare. The women are supported economically, because without economic support, these women will keep lagging behind. Because of poverty, they cannot access healthcare, they cannot make decisions. So I strongly say that women must be supported to come out of the cocoons that have kept them behind for so long, depriving them of the service.
Yeah, that's a very emotive issue.
5 minutes.
5 minutes, all right. I'll just, like what the doctor said, my sister said earlier on, I think it's also to do with where we prioritize, where we put our resources. I just gave an example of South Africa, for instance, where a lot of grandmothers are becoming mothers again because of the COVID-19 pandemic. So when we talk of empowering women and talk of them being resilient, I think governments should put their money where their mouths are, so that these women, because I read, African American women, for instance, are now saying we are tired of being resilient. We are tired of being, the good mothers who are carrying our sons, our daughters, our families, and that the government should put its resources where its mouth is. So I think it's something that should be worked on. Thank you.
Yeah, thank you very much. And this brings actually to the end of our conversation today, and I really thank everybody. So basically, Africa needs to prepare more and to take measures again to contain the virus. It's not time to relax. We thank God you have been resilient, but you have to increase the resilience. And I really thank each of you for being part of this talk show, and I hope to see you next time.
Thank you, thank you, thank you. Thank you. And thank you to the two doctors. I learned so much today. And thank you, Emetha, for inviting me. Thank you.
Thank
Yeah,
you,
so
thank
amazing.
you. Thank you, everyone, for your participation.
I hope we can have a part 2. Thank you.
Yeah, thank you. See you next time.